This is Damian McNamara, Global Medical News Network at the Florida Society of Dermatology and Dermatologic Surgeons meeting in Naples, Florida. Dr. George Cohen will speak about challenges for treating patients with skin of color. Dr. Cohen, thank you for being with me.
It's a pleasure. Glad to be here.
You're giving a talk at this meeting about some of the challenges of medical and surgical challenges for patients of skin of color. And first I want to ask you to kind of break that into two parts. What are some of the medical challenges that you see with these types of patients?
Sure. When you have patients with skin of color, there are two types of medical challenges. One, certain diseases are more common in patients of color, for example, sarcoidosis and lupus. And if one has not had sufficient exposure to these type of patients, one could be at a loss. So in addition to the different types of diseases, it's a difference in disease presentation. So psoriasis may not have the typical erythematous look. It may be dusky, it may be purplish. And the other thing is certain conditions that may not be as important in the majority population may be of tremendous importance of a person of color. For example, vitiligo. If a person's skin is relatively light, the light spots of vitiligo may be inapparent and easily disguised, where if a person has a very dark complexion, they're obvious and very disconcerting.
Right, so it has more of an impact sort of socially and psychologically and all
Exactly.
that.
Yeah.
Okay, now you're also going to address some of the surgical challenges in this population.
Right.
Robert, could you give me a few examples of that?
Sure. The biggest surgical challenge is the propensity for black skin to either keloid after certain surgeries or to have pigment abnormalities. So, for example, laser resurfacing treatments, which are very common in a Caucasian population, may produce profound pigmentary disturbances in skin of color. Some people with skin of color are more prone to keloid formation, particularly when you're doing surgery on the chest and trunk. So these challenges have to be kept in mind.
This has been Damian McNamara, Global Medical News Network.